Without Aggie Hirshberg, there's no pancreatic cancer program at UCLA.
We were the first foundation for pancreatic cancer.
Her primary mission has been to help patients and families who have the disease.
We're making a difference. I know we're bringing awareness to our fight.
We're a small but passionate group of people just trying to make a difference in the fight against pancreatic cancer.
That fight began on the UCLA campus with the opening of the Ronald Hirshberg Pancreatic Cancer Research Lab in memory of Aggie's husband.
When we started, this lab was the only lab here at UCLA that studied pancreatic cancer. There were not many pancreatic cancer laboratories in the country.
In addition to the lab, the foundation created and funded one of the first pancreatic tissue banks.
The surgery gives us an opportunity to get tissue, and the tissue is then banked.
And with the tissue, we will be able to distribute to any investigator who are interested to understand how the disease process occurs, how the disease spread, what are the genetic abnormality, and the stage of the disease.
Part of the mission statement is to fund new projects designed to improve patient care, treatment, and survival rates. Out of that, the first LA Cancer Challenge was born.
I took it from a small event when John handed it off to me, and now it's one of the largest 5Ks in Southern California.
An annual event that has raised millions of dollars.
There's no way we could be growing this race without those people who are just in it for the fundraising aspect, constantly trying to think of ways to make it better for the families that have been touched by pancreatic cancer, where this might be the only event they go to all year.
There's tremendous amount of energy that comes from a team event. And we run together, we train together as a team. Having those people around me was a tremendous inspiration.
When I come across that finish line and I ask my kids, why are we here and what are we doing? And their answer is, we're fighting for the disease that took your dad's life.
With funding now coming in, the foundation was able to expand its critically needed seed grant program.
And the first year, I think we had 4 applications. Today, we have 45 to 50.
But this process that she's put in place allows the potential to bring more people in the fold of doing pancreatic cancer research.
The size of the grant is $50,000 per year for a year's worth of work. And at the end of the year, they have results.
Those results are reported at the annual Symposium, a unique and intimate forum that puts doctors and patients together in the same room.
Good morning, welcome to the 10th annual Aggie Hirshberg Symposium for Pancreatic Cancer.
The meeting started with 10 people, and now we're up to 150 or so.
We really have more and more focused it to be principally to the patients and their families and friends.
I'm a 23-year survivor.
You have that freedom, that liberty to express yourself. The foundation brings people together, and I think that's very rare.
To try to tell you how many patients we help a year, thousands.
The newest addition to the fundraising events is the Tour de Pier, which had a highly successful inaugural year.
It's unique, so to be able to do it outside, riding in front of the iconic Manhattan Beach Pier.
There were tears, there were signs, there were people dressed up, there was energy. I'm not a doctor, I can't cure cancer, but I put it on the win column as far as making a difference.
Raising awareness, fundraising, and patient care, all done with a very small group of individuals, each one touched by pancreatic cancer.
It all started with Aggie making a commitment.
We never forget about remembering loved ones. Once you're diagnosed with pancreatic cancer, once you have a loved one who's been diagnosed, you are a part of our family immediately.
That's what is special to me, is to be surrounded by everybody who has the same goal, the same drive to find the answers for this disease.
The Hirshberg Foundation for Pancreatic Cancer Research. You can hope, or you can help.